Hi, I'm Hannah and this is Advice from Akota. And today we'll be going over some movements and exercises to help you regain movement post-stroke with your affected arm, all the while maintaining your joint health and keeping your affected arm strong. So today we'll need a tabletop, a rag, and a cylindrical object that you can grasp comfortably. If you're not at the grasp part, that's okay, that's not until the end. So do the movements up until we get to our fine motor component. So for the purpose of this video, I'll be pretending that my right arm is my affected arm and that I have some spasticity in this arm. Now remember, everyone experiences stroke recovery differently and recovers at various rates. But these exercises will help you regain some function while at the very minimum maintaining your joint health. So begin with me in this warm-up, and we'll start with something called active range of motion, active assisted range of motion. So what we'll want to do is, especially if you have tight hands, really try to stretch out those fingers and get a good grasp in between all of your fingers. So you're interlacing your hands. And we're going to start with something called shoulder retraction and protraction. So we're using our unaffected arm and we're guiding our affected arm straight forward in front of us, remembering that there probably is going to be some tension, and then squeezing our shoulder blades back behind to pull our hand back in. Now we want to initiate the movement with our affected arm. So if we have that push and pull movement, we're starting that movement with our affected side. Our unaffected arm is just helping us achieve the end range of that movement. So concentrating on moving that affected arm. So you do 10 to 12 repetitions here. And once you've reached those 10 to 12 repetitions, we'll go into elbow flexion and extension, really focusing on extension because usually if we have spasticity, we have tightness through that elbow joint. And being cautious, being careful not to overstretch or move too quickly through these movements, causing more injury to that affected arm. So work with your therapist to make sure you're doing these correctly. Remembering there will probably be tension, so it's going to be a little bit of a challenge to straighten that arm. But you're leading with that affected arm and helping with your unaffected arm. Once we've gone through 10 to 12 repetitions of that, we'll start our diagonal movement patterns. So we're going to try to straighten that arm and touch the outside of I'm going to start with my right knee, then reaching across to my left shoulder. Working through that tension, but not overworking, listening to your body, making sure you're not having any pain with these movements. And you'll do 10 to 12 repetitions going through this movement pattern. And once you've completed those, you're going to switch. So you're going to go to the outside of your opposite knee, back up to your shoulder, 10 to 12 times. Really trying to extend that elbow to a range that you can tolerate, not overstretching or hurting any of that tissue. So 10 to 12 repetitions there. And then we'll go into something called pronation and supination. So you're flipping your palm of your affected arm face down and then trying to turn affected palm face up. Again, going to a range that's comfortable for you. That's usually one that's kind of challenging, is palm up. So you'll do 10 to 12 repetitions here. And then I like to go back to that initial exercise of bringing our arms straight out of that shoulder protraction and squeezing in, just seeing how your arm maybe the flexibility has changed throughout those exercises. 10 to 12 repetitions. And our last warm-up move, at our end range, when we're bringing our hands out in front of us, we're going to lift our shoulder up, so shoulder flexion, slowly bringing back down, going to a range that's comfortable for you. Now, doing these exercises in front of a mirror is especially helpful, or with some tactile cues from somebody, like your caregiver or your loved one, so that you're mimicking a normal movement pattern. 10 to 12 repetitions there. Next, we'll work with our tabletop. So take a moment, pause, and set up your table. Okay, now that we're in front of our tabletop, this is the moment to pause and make sure that your healthcare team has approved weight bearing through that right arm and that you have worked with your therapist on proper positioning through your weight bearing arm. So these exercises entail exactly what I've stated. Weight bearing through your affected arm, through your shoulder, to give us some proprioceptive feedback, firing those muscles, preventing subluxation, and just giving us better fine motor coordination later on. So from here, after you've had some good stretching, you're going to try to flatten your palm on that table in front of you. And you really want to achieve this 90-degree angle. So you don't want your arm too far in and you don't want your arm too far out. You want like a nice normal joint alignment with that 90-degree angle. And again, you can do all these exercises with your palm facing out, or if you can achieve a nice palm facing down, that's great too. So the first thing we'll do is we'll mimic with our unaffected arm, and we're going to lean forward and back, just seeing how that pressure feels on the shoulder today. And you'll do that about 10 to 12 times before you're going into your lateral leans, where you're putting more weight on your affected arm and then your unaffected arm. So you're shifting your body weight laterally. So grading the pressure in each of your arms. So you should feel, when you're leaning to the left or to the right, you should feel more pressure in that arm that's directly underneath that weight. Making sure you're not feeling any pain. If you do, stop. And you'll do that 10 to 12 times per side. After that, we're going to take our unaffected arm and we're going to do a diagonal reach across our body and a pull back. So you'll feel when you reach diagonally across your body, you're putting more weight into that elbow. So you're getting more pressure through that shoulder. And so you'll do that 10 to 12 times. And you may need to adjust this hand as needed. If your fingers start to curl up, try to re-flatten that hand down. So that is our weight-bearing exercises. So pause here. Okay, welcome to our fine motor section. So we'll start off with using our rag. So from here, what we'll do is, if we can, we're going to stretch out our fingers and our thumb and try to turn our hand on top of this rag. And what we'll try to do is then crumple that rag underneath our hand and help with our unaffected hand, if we can, to lift. And we're gonna bend at our wrist using our unaffected hand if needed to try to release that object, helping as needed. And then we'll set up again. So we'll try to stretch out those fingers on our rag and then use those muscles in our fingers, flex our fingers to try to crumple this up underneath us, guiding with our unaffected hand up, releasing at the wrist to release. And you'll do this 10 to 12 times. And maybe you have someone that's able to help you, that's great too. So you're crinkling, guiding the arm up if needed, helping to bend at the wrist. I'm using a finger here so I can really try to bend and think about releasing my hand, but helping with that unaffected hand as needed. So do that 10 to 12 times. And then we'll work with our cylindrical object, which could be anything from a cone to a cup. And what we're doing is working on this hand-to-mouth pattern that's needed for self-feeding or oral care or grooming and hygiene tasks. So you're going to use your unaffected arm as needed. If you don't need to use your arm and you have an accurate placement when you're bringing your arm forward, that's great. But if you need to use your affected arm, go ahead and do so. I will just guide my arm towards this cylindrical object, kind of breaking at the wrist. I press in at the wrist, and I'm gonna help my fingers to get around the cylindrical object. I'm gonna use my unaffected arm if I need to bring this object up to my mouth and then guide that object back down and then actively try to release, maybe helping my fingers as needed. And I'm gonna bring my arm all the way back, starting at neutral again. And we'll do this 10 to 12 times. So very functional movement. So you're either guiding your arm forward, trying to get that accurate placement, or helping your arm as needed, breaking at the wrist to try to get your fingers wrapped around, but actively trying to open your hand as much as you can, and then trying to grasp onto this object using your unaffected arm if needed. If not, you can try to do this pattern. You can maybe even slightly use your other hand to help here, or grasp here to bring the cup up to your mouth, and then back down. Then really thinking about that release. And those are two really good grasp release activities to incorporate, as they're so functional. And in order to get good results with stroke rehabilitation, it's all about repetition. So not only doing these exercises throughout the day, but incorporating the use of that affected arm into your day-to-day life. Whether that looks like at your meals or when you're thirsty, trying to use this arm along with your unaffected arm to actually drink out of a cup. Think about how many times you'd be using that arm throughout the day. Or perhaps you're able to put lotion into your affected arm and rub the lotion into your unaffected arm as much as you can. Just even try. Or washing your arm using a washcloth in the shower. So trying to use that arm to bathe. And even trying to just adjust your clothes with this arm as much as you can. Thinking about how we were grasping this washcloth on the table. Thinking about grasping your clothes and pulling them down. And grading that until you're able to do it more and more easily. So use that arm throughout the day. The more you use it, the more your joint health is better, the less pain you have, and hopefully the more functional use of this arm you'll get. So if you enjoyed this tutorial, join me every week for a new tutorial, not necessarily focused on stroke, but other conditions as well. Subscribe and like, and I hope to see you next time.